Okay, so nutrition counseling. I just want to briefly share this content or this disclaimer that essentially this information is just that. It's intended to be information only. So whatever I present, it's really not intended to be a substitute for professional medical advice to diagnose or to treat. Any issues that you think you have with nutrition should be discussed with your healthcare team. So your needs and your nutrition advice or any specific questions that you have about managing your condition is best answered by those who know you best medically, and that's your healthcare team. So on the agenda today, I want to first start by asking this important question: why is nutrition important? Then I'd like to explain what the experts recommend for cancer protective nutrition. I'm going to spend a good amount of time on what we call nutrition impact symptoms, but most importantly, give you some solutions in order to optimize the nutritional well-being of yourself or your loved one. And then I'm going to list the most common nutrition questions that I receive, as well as those that were submitted ahead of time. And as I mentioned, we'll have some time for a demo and a little Q&A, which is usually my favorite part of the program because I don't love doing all the talking. So thank you again for participating. Okay, so why food? I wanted to share with you all my professional and personal philosophy. I think that we eat for good reason. We need to, right? It helps us stay healthy. It helps fight disease. It provides nourishment. You know, that's really a primary responsibility of food. And the definition of nourishment is that it's necessary for growth, health, and good condition. But I also think that we eat for other reasons. And one of them is that we connect with one another over food. It's this really nice vehicle that really heightens the relationship that we have with one another. And also, probably most importantly, food is one of life's greatest pleasures. I hope you agree with me. Now, I mention this because many times individuals that I work with lose this. There's a loss here. They've lost the pleasure of eating food, and they've lost that opportunity to connect with their loved ones. So depending on the individual's goals, my responsibility is to partner with them, and not just once, but really to establish a relationship with that individual. And we might find ways to make food enjoyable again. And so you're going to hear that from me today because I think it especially relates to the pancreatic cancer population. So how is nutrition status impacted by pancreatic cancer? Well, it's pretty significant. Before diagnosis or at the time of diagnosis, we can see there's a depletion of nutritional status, and that's related to the disease process. It creates negative changes to metabolism, and this can manifest itself with weight loss, but especially the loss of muscle and consequently malnutrition. Now, unfortunately, this can all be complicated by treatment, right? So even before someone starts treatment, they may be behind the ball and they may be malnourished. We know that treatment such as chemotherapy, surgeries, as well as radiation, or a combination of any of those, can create some significant side effects that may also impact nutrition status. So we call those nutrition impact symptoms, and examples are poor appetite, weight loss, gastrointestinal distress or digestive distress, and that includes diarrhea, gas, and bloating. So this can make that potential malnutrition even worse or put someone at risk for becoming malnourished. So why do we care about malnutrition? Well, it's highly prevalent and it also adversely affects outcomes. So the prevalence of malnutrition is pretty significant. If you were to guess a percentage of the prevalence of malnutrition in the pancreatic cancer population, what would you guess? Hopefully that you're dropping some comments in the chat. So it's 80%. That's what the research shows, that 80% of our pancreatic cancer patients are malnourished. Now, why is that so concerning? Well, there's clinical consequences. We see that there's a reduction in the response to treatment because of malnutrition. It can increase the side effects of treatment. It can reduce quality of life. It is also an independent prognostic variable. So what that means is that it levels the playing field. If you have stage 1 versus stage 4 pancreatic cancer, if you have stage 1 and you're malnourished, it doesn't matter that you're stage 1. That malnutrition can independently predict that you may not survive that cancer. And unfortunately can lead to cachexia. So cachexia is this multifactorial kind of syndrome, and it's really related to the disease process. And there's a continuum. So it starts as pre-cachexia, and if a nutritionist or an oncology dietitian can intervene early, we can help delay the progression to cachexia. And that's important because 20% of all of our cancer deaths occur simply because of cachexia, not because of the cancer. Well, there's good news. So there's something that we can do about it. And there's this great tool called the Malnutrition Screening Tool that is validated. And it's a simple way to screen yourself or a loved one to determine if you are at risk for malnutrition or if you are already malnourished. And it's a score of 0 to 3. There's 3 simple questions to answer, and it helps give you that validated score so that you know what to do next. So what I've included in the slides, as well as that nice little handout that I put together, is a link to a free validated malnutrition screening tool. We call it the MST. And again, it's going to give you that score so that you can take those results, bring it to your healthcare team and say, listen, I might be at risk for malnutrition or I am malnourished, help. And the citations on there as well. Okay, so there's even better news because nutrition counseling in those individuals with pancreatic cancer can improve that risk for malnutrition as well as that person who is malnourished. We matter, we can make a difference. So we have been shown in the research, oncology dietitians have been shown to help retain and restore nutrient stores as well as body weight to improve the tolerance to treatment, improve surgical outcomes, improve healing, and one of my favorites, I think one of the most important things is to improve quality of life. So hopefully you have access to a dietitian because these are the things that we bring to the table. Okay, so I'm going to move on to the next part of the presentation. What is it that the experts recommend for cancer protective nutrition? So I'm going to talk about what the experts want you to know, as well as try to set their record straight about this relationship of nutrition and cancer, because I know there's a lot of information out there and it's very difficult to navigate. And so I want to help you feel more confident that you know where to turn for reliable information and that you have the best solutions at your fingertips. Okay, so during treatment and even shortly after treatment, here are the general recommendations as it relates to nutrition status. We want our individuals to maintain a healthy body weight, especially lean body mass, which is really their muscle, their skeletal muscle. We want our individuals to achieve adequate consumption of our macronutrients and micronutrients, so calories, protein, and fat, as well as micronutrients. So those are our vitamins and minerals, and that varies according to the individual. We might include high calorie and high protein food and beverages in a lot of different creative ways. We may suggest supplementation. Sometimes there are some reasons for why someone might need various products, and again, determined on an individual basis. And then we also may modify the diet, especially as it relates to texture, in order to address some of those nutrition impact symptoms, but still ultimately optimize nutritional intake. Now, I want to point out, again, I'm giving you general recommendations. So I think the best solution for you is to think about consulting with an oncology dietitian, because that's where you're going to get your specific guidance for what's best for you. No two individuals are the same with nutrition goals. Now tell me, have you ever encountered something like this? Maybe you searched online or looked on Google. What can I eat to cure cancer? Maybe you saw something like this image. So these foods are high in alkalinity, or they alkalinize our body. Is that going to cure our cancer? Or how about the opposite? Have you ever seen something like these images that suggest if you eat these foods or drink these beverages, you're going to get cancer or make your situation worse and cause the progression of cancer? Well, let's set the record straight on this one. These messages are not based in evidence. Okay, that's my responsibility to provide for you today what the evidence suggests. And a lot of the information out there is downright misinformation. It's false, it's inaccurate, it's unreliable, it sometimes is outdated. So there might be an inkling of truth about it, but there's so much more to the story, and it's an evolving story. So that's my responsibility, is to have my finger on the pulse of what we are looking at in the research and what the experts are concluding from all of the research that has ever been done on the subject. Now, I do what I do because I think that these messages can create unnecessary stress and add to anxiety for individuals who are already overwhelmed and burdened by their current state. So my responsibility is to help them navigate this type of information and, again, build some confidence, because we know that stress and anxiety is also not good for us. So we want to minimize these types of messages if I can. So what is it that the experts recommend? Well, this is one of my favorite graphics. It's from the World Cancer Research Fund, and they are a consortium of about 5 international institutes. So here in the States, I use the American Institute for Cancer Research, but they have this wonderful database, and it's essentially our experts from all fields, including oncology, that filter through all of the available studies that are done. Study after they sit down and they talk about it. They duke it out sometimes, which studies are better than others, and then they can provide us with a summary. So this is sort of my lifeline, and because they do all the work for me, right? Sometimes I read research studies, but it's hard to keep up. So they do a great job of this, and they summarize what they find in the research with these recommendations on this graphic. So what you're going to see is that it says cancer prevention recommendations, and maybe you're thinking, Lori, I've been diagnosed, please help me. What I want to point out is that their final recommendation is that anyone who has been diagnosed should try to follow these recommendations as much as possible, because as it turns out, many of them exert similar cancer protective properties. So all along the continuum of that carcinogenic process, what we're finding in the research, and it's only building more and more, it's very exciting, that these recommendations can help delay the progression of a cancer. Now, my favorite recommendation on this slide, I should have probably quizzed you, but it happens to be this one: eat a diet rich in whole grains, vegetables, fruit, and beans. And we affectionately refer to this as a plant-based diet. And I'm going to come back to this this point in my presentation. So I mentioned what I love in terms of the recommendations, this whole food plant-based diet, and that contains mostly whole grains, beans and lentils, fruit, vegetables, nuts, and seeds. And why are they one of our favorites? Well, that's because they are what I refer to as cancer's worst enemies, food enemies, wrapped up in a package. So these plant-based foods have antioxidants, they have fiber, phytochemicals, as well as a special B vitamin, folate, that I'm going to talk about now, actually. So in the research, there have been some specific food and nutrients that are implicated with pancreatic cancer. Now, what I want to point out is that the most compelling research suggests that it's the overall diet pattern that matters most, and not these little individual nutrients. So we might want to pay some attention to them. So the first are some B vitamins, folate and peroxidine, which happens to be called B6. And these are B vitamins that are involved in the synthesis of our DNA, and they help keep our DNA healthy if it starts to become abnormal. There's some information about high glycemic index foods, and so there are some certain foods that can significantly raise our blood sugar. And I'm going to talk a little bit more about that today. And then lastly, vitamin D. So we refer to vitamin D as the sunshine vitamin. There's not a lot where I am today, unfortunately. And that's because we synthesize the UVB exposure from sunlight into vitamin D in our body, which is really cool, I think, by the way. Okay, so I'm going to start first with those B vitamins. So folate and peroxidine, as I mentioned, they are B vitamins that are involved in the synthesis of DNA. Keep in mind, an overall diet pattern matters most. But adequate amounts of these B vitamins in the diet exert a protective effect by repairing our DNA. And there was some research that those individuals, they would compare them. Those that ate more folate and ate more of peroxidine or vitamin B6, they had a lower risk of developing pancreatic cancer. So there's something about this special role that they have with repairing that DNA. And it's actually called methylation, which is like a wordy set way of saying that it helps synthesize healthy DNA. So what's good to know is what foods provide us with folate and peroxidine, right? So here are the top food sources of both of those B vitamins. Specifically folate, black-eyed peas, one of my favorites, asparagus, Brussels sprouts, salmon, potatoes, broccoli, green peas, and kidney beans all supply a hefty dose of folate and B6. Next, I want to talk about high glycemic index foods, and you see that asterisk there. In the slides, I put the asterisk next to items that I put together into your little handy packet for you to rely on for helpful information or just to elaborate upon what I'm talking about now. So remember, an overall diet pattern matters most, but what is it about these high glycemic index foods? Well, we define them as being processed foods generally that have added sugars, and these types of foods, they lack valuable nutrients. If we overconsume them, it can lead to weight gain, and it can also raise our blood sugar when consumed in excess. So that weight gain is a concern because overweight and obesity is associated with 12 different types of cancer, and pancreatic cancer is one of them. And it has to do with inflammation as well as high blood sugar. So examples of foods that are processed with added sugars that are high in glycemic index. I don't know, are you surprised by these? Soda, some of our fruit drinks, and even sports drinks. I like to point them out to individuals. There might be better choices. And then candy and refined carbohydrates. So I encourage individuals, and I work with them. I literally have gone to grocery stores with individuals to look at labels, or they'll take a photo of a label and email it to me, and then I can help them decipher what makes sense for that product, and is it a nutritious choice for them. But we can look at this for added sugars. The goal for added sugars for females is less than 24 grams of added sugar and less than 36 grams for males per day of added sugar. So that's now on our food label on the nutrition facts panel, and it's a very helpful way to see how much of that product contains added sugars. A dietitian can best help with navigating all of that information, of course. So here's a little how-to about minimizing high glycemic index foods. I would suggest you do some swaps. I'm a big fan of those. So instead of some of those refined carbohydrates, like white bread, white pasta, white rice, could you make some suitable substitutions in easy ways that are also tasty, like whole wheat bread? There's whole wheat pastas on the market that are high in fiber and minimally processed. One of my favorite whole grains is bulgur for how easy it is to prepare. And then oats. I'm going to talk about oats a lot today. Fruit juice is high in glycemic index, so to manage blood sugar levels, fresh fruit is preferred. Some of our snack foods that are full of refined carbohydrates, a great swap out is air-popped popcorn. I have a recipe if you want it. It's delicious and high in fiber. And then something like instant potatoes, I'd love to suggest sweet potatoes or winter squash. They're more nutrient dense. A white potato, red potatoes, they're delicious too, and they contain a good amount of nutrition. the sweet potatoes, the winter squash sometimes afford a little bit of different nutrients for some individuals that I work with. Okay, lastly, I want to talk about vitamin D, or sunshine vitamin. So remember, we synthesize this from the sunlight, from being exposed to UVB rays. Now, an overall diet pattern matters most, keep that in mind. But what's interesting about vitamin D is actually the experts do not know how it is protective in pancreatic cancer. They have a couple theories that they're looking at, but they haven't really discovered what it might be, or is it a combination of things that vitamin D does in order to exert its protection for pancreatic cancer. What we do know about vitamin D is that it can stimulate the immune response, promote cell death. So if a cancer cell is not dying like it's supposed to, vitamin D has responsibilities to tell that cancer cell to die. It also is important in regulating insulin, and it has anti-inflammatory properties. Now, how do we get vitamin D? From the sunshine, right? So what they advise is exposure to sunlight easily on our hands, so we can keep our face covered and most of our body covered for 10 to 15 minutes for about 3 days per week. Now, there's a lot more to talk about that, because there's a significant time of year when we do not convert the sunlight or UVB rays to vitamin D in our body. That's our winter months, our colder months. The temperature as well as the sun does not allow for that conversion. And it's really like mid-fall through late spring when we might not be getting adequate amounts of vitamin D from the sun. But there's good news. So we can actually get blood work done, and we could test whether or not we have sufficient levels of vitamin D in our body, and if we need to take a supplement. Now, we don't eat a lot of vitamin D, unfortunately, so it's not something to rely upon in our food. And that's why I refer to it as being the sunshine vitamin, because that's probably where we're going to get it, not in our diet, actually from the sun, or from a supplement if we're taking one and if it's safe to take one. So here's where we find vitamin D in food. It's in rainbow, trout, salmon is actually our best source, and then you will also find it in some fortified products. That's where reading labels comes in handy too. Okay, so next part of the presentation, I just want to talk about symptom management. These are the most common nutrition impact symptoms that individuals that I work with have to encounter. Again, it could be at the time of diagnosis or even throughout their definitive treatment in recovery from their surgery. These are the ones that most often come up. But my responsibility today is to provide some solutions. So I'm going to really focus on how to optimize nutrition and also manage these symptoms. Okay, so I'm going to start first with poor appetite and weight loss. So the first thing to consider are your eating habits or your loved one's eating habits. And I would suggest with a poor appetite that person includes small, frequent meals, because we cannot expect that person to consume normal serving sizes, right? I think it helps also to schedule or create a routine about meals, right? So if it's every couple of hours, that may work for that individual, but you can get into a nice rhythm by doing that. We often encourage liquid calories and also high calorie, high protein choices, because we want to achieve bang for buck, and I'm going to talk about that. And then a little bit of light activity has been shown to help stimulate the appetite. So here's some high calorie choices that are among my favorite list. There's avocado, olive oil, nuts and nut butters, as well as nutrition drinks, whether it be a commercial product or something that you make yourself. And then we're going to layer in some high protein choices. So again, those nuts and nut butters. There's also seeds and butters of seeds too. Eggs usually work really well for individuals that I work with. And then other plant proteins, tofu, tempeh, as well as hemp seeds. They're surprisingly high in protein, and they're part of my show and tell today. But I list these as choices because for many individuals that I work with, they develop an aversion to meat. So I wanted to list those that are sometimes more tolerated, that are also high in protein. So how do we add more calories and more protein to some of your food choices? I suggest, again, liquid calories, because liquid calories don't really fill us up. So we're able to squeeze in sometimes a good amount of calories and not feel full from it. So to sip on a homemade smoothie, or again, a commercial product, to sip on that throughout the day is a great way to really close the gap to meet nutrition goals. I also bring up nut butters because for a measly tablespoon, there's 100 calories. So they can easily be added to different recipes, but also there's an energy bite recipe that I'm going to demonstrate. Olive oil, or any other oil for that matter, but olive oil rates a little bit higher in terms of its nutrition. A measly teaspoon is 50 calories. So I think about the Mediterraneans who like literally will at the dinner table drizzle some extra olive oil onto the dish, and could extra be added to cooking. And then also avocado. So a third of an avocado is 80 calories, and there's lots of different ways to add it to recipes. One of the hospitals I used to work at would send on the trays in the hospital, they would send slices of avocado for patients. It's sort of nice and refreshing too, I think, in the mouth. It's nice. It's a nice option. Okay, so next up, nausea and indigestion. Again, I want to talk about those eating habits. I think that for individuals that are nauseous, one of the most important strategies to consider are small, frequent meals. Because I use the expression of not letting the tank go empty, because our stomach is that. It's a big reservoir. It's a holding tank. And if it's empty, that's when nausea and indigestion rear its ugly head. So it is about eating something every couple hours. I say, of course, this is where I work with the interdisciplinary team. We want to make sure we're optimizing the timing of prescription for anti-nausea medications, as well as timing meals around that. So some may reach their most beneficial point, and we want to make sure we're eating around that time, right? I also troubleshoot with the sense of smell. So many individuals I work with, they find if they smell something, and it might not even be food, if they smell something, that's what triggers their nausea. So sometimes we want to serve room temperature or cool foods in order to address that. And certainly letting gravity do its work. So remaining upright after eating is really important, especially for someone who's struggling with fatigue and not getting out of bed. We want to try to prop their head as much as we can. That's going to minimize both nausea and indigestion. So some of the preferred choices to try, I've listed here. I find that the more plain, the better. So plain noodles, broth, again, those nut butters, clear nutrition drinks, because a lot of the commercial products you'll see are milk-based. And so sometimes that creamy, sweet isn't desired. And there's a lot of other products to consider on the market that are going to be easier on the tummy. Ginger is known as a remedy to help with nausea. So adding ginger in some of the recipes, the one I'm going to demonstrate today does that. Eggs are well preferred by many individuals I work with. I bring up tofu again for its versatility and high protein choice, as well as some baked chicken that's left over, right? So if a caregiver's making chicken and it doesn't smell right for the patient, you may want to just cook it ahead of time and then serve it the next day left over, because if it's cool or room temperature, it might just be tolerated that much better. So how to nourish yourself if you're feeling nauseous? Again, I think the more simple, the better. Plain noodles, plain pasta, rice, potatoes. I mentioned pastina. They're tiny little, hopefully you're aware of these. They're little tiny pasta noodles. And I think because of that, that texture sometimes is well tolerated. Sometimes visually, if the sight of food can also create some nausea. So sometimes manipulating how food is served is helpful. Cook those items in broth, right, to add some protein. And there's also a great recipe in your packet for an on-the-go snack mix, because a lot of times with nausea, dry is preferred, not moist. Okay, so dry crackers, dry pretzels, even some nuts and seeds if they're tolerated. Those are great to help combat that nausea. I mentioned ginger, and there's a lot of ways to add ginger, even in tea or to hot cereal. Tofu, so many ways to play with tofu. And if you want to talk about that more. We'll save it towards the end. And then I mentioned chicken, sometimes even turkey. If it's plain and served leftover, you might prefer that best. There's so much activity. I love it. Okay, so next up, we're going to talk about high blood sugars. So with high blood sugars, this is where a consult with a dietitian is especially helpful, because we're going to look at eating habits. Primarily, we're going to try to control the portion of carbohydrates that are consumed throughout the day, but also at the meal. We're going to partner carbohydrates because they're best eaten with a buddy. So that buddy should contain some protein and fat. And then routine is very helpful for blood sugar control and developing a schedule that is consistent. So here's where we find our natural carbohydrates, and these are the quality carbohydrates that we want to include in a healthy diet: grains, fruit, milk, and yogurt. So our grains include our whole wheat or minimally processed versions, right? So pasta, rice, cereal, some of our starchy vegetables, as well as bread and crackers. We're going to look at that label, make sure we're making a quality choice there. Whole fruit, as well as frozen fruit, they are naturally high in carbohydrates. They're the good kind of carbohydrates, and we want to make sure we include in our healthy diet because they also are cancer protective. And then milk and plain yogurt contain carbohydrates. You see the serving size listed on the slide as well. The yogurt that's sweetened, so it has some extra fruit or extra sugars added to it, and that's where you read labels, that counts for both natural and added carbohydrates. So there's better choices to be made in that family. And again, that's where a dietitian can help. Now, how do we try to plan meals so that we are controlling our blood sugars, and how do we do it in nourishing ways? Well, we want to remember that concept of partnering. Okay, so eating that quality carbohydrate alongside a protein and a fat. Not only is this good for blood sugar control, but I would say this is good for someone who doesn't have a great appetite or is losing weight, because what you're doing is you're really maximizing, even if the portion is smaller, you're maximizing nutrition here. So you're consuming a quality carbohydrate, something like whole wheat toast, with the protein, like a hard-boiled egg or even a poached egg, and then adding a quality high-calorie food like a fat, like mashed avocado. And so you see some other examples listed there on the slide. That's one of my most favorite things to do when I'm working with individuals, is help them decide with what they're eating, how to make some like subtle changes so that they really are accomplishing their goals. Okay, so next I want to talk about diarrhea. So there are food and beverages that are triggers, most commonly triggers for diarrhea. And they include lactose, a special type of fiber called insoluble fiber, and then some of our sugary beverages. But I would also say artificially sweetened beverages can also exacerbate diarrhea. So we want to just look for some substitutions, because maybe the treatment is what caused the diarrhea. So what you were able to tolerate before, you can't tolerate so much now. And the inclusion, again, of the medical team for prescription or over-the-counter products is really fundamental in making sure that diarrhea can be best controlled. And food is only going to complement that approach. So we're going to make some substitutions with dairy, and there are a lot of alternatives on the market. That's asterisked for a reason, because I'm going to talk about that in a moment. Then we're going to look at the source of fruit and vegetables, even some of our whole grains, maybe some of our beans and seeds and nuts. Are they high in insoluble fiber, which is going to exacerbate the diarrhea? So we might just peel the fruit or cook the fruit and blend it in a soup or put it into a smoothie. Lots of creative ways to incorporate fruit and vegetables still, so that they're not lost in the overall diet. We're also going to focus on foods that are high in soluble fiber. They are included in your packet, and I'm going to talk about them also. Soluble fiber has this really special, helpful property. It slows our gut down. So it's great for controlling blood sugars, but it also helps to bulk up a loose stool and slow down the gut. So I'm always looking for ways to incorporate foods with soluble fiber for anyone who has diarrhea. And then lastly, sugary beverages. So our sodas, our juices, even our sports drinks. okay, they help to hydrate, but they may exacerbate diarrhea sometimes. So we might look to substitute with some homemade versions of hydrating fluids. I've included them in your packet, and they're superior in terms of their ability to hydrate. So how to include some nourishing gut-friendly choices? I want to list the foods that really are good for the gut. So oats, sweet potatoes, bananas, and rice, and even beverage versions of them usually are better tolerated. Like I have people actually make banana milk, and it's just blending banana with water, and then they can consume that. But you see examples of how to enjoy these foods, most of them just as they are, because just like nausea, same goes for diarrhea. I would say the more simple, the better. So not making the dish or the meal overly complicated, just cooking some oats, maybe grinding the oats smaller, and then making it with water if that's what's most tolerated. Sweet potatoes have some of that soluble fiber, the flesh of the sweet potato, right? Not the peel or the skin. So there's ways to mash that or blend it into a soup. Bananas are like a gut's best friend. I think they're really good buddies with rice and oats especially. And there's lots of ways to incorporate bananas. I like to have them almost always in my freezer frozen because they're great to add to a smoothie, but really nice ways to mash it and maybe even spread that on top of toast. Really a convenient, I think, nutritious choice that also supports the gut. And then white rice, we understand, is one of the best tolerated choices for our gut. And so we'll use all different versions of rice, and we'll start with just plain rice, maybe make a rice congee, which I included that recipe for you. It's basically just cooking a long grain rice for a longer period of time. And then even sipping off that liquid from the congee, great for the gut. It really helps settle the gut down. But then we'll look to make steps and transitions from that rice and look at things like rice cereals that are dry, or even rice cakes. Rice crackers are on the market, and cooking that rice with a chicken broth. You know, there's lots of ways to advance upon just that plain rice. I want to talk about a special type of diarrhea that's a problem related to fat malabsorption. So we call this exocrine pancreatic insufficiency. And the symptoms are these. Very common, actually. Indigestion, cramping, large amounts of gas, foul-smelling stools or gas, floating stools or even greasy stools, loose stools, and an unexplained weight loss. So what's the remedy for this? Well, there's really only one, and that's a prescription for enzymes. So these enzymes do the job of what the pancreas is not quite capable of doing, and they should be taken at the first bite of food and even throughout the meal. And sometimes that requires a little troubleshooting. The dosing also requires a little artwork, and they should be taken separate from antacids and iron supplements. If anyone is on enzymes, I would say they should also absolutely be working with a dietitian to help them understand the dosing and how to time them with what they're eating. So what to do if you suspect you have exocrine pancreatic insufficiency? Discuss this with your medical team. If you have any of the symptoms that I just listed, I would say, you know, should you be evaluated for fat malabsorption? It's worthy of a conversation. If that EPI or exocrine pancreatic insufficiency is diagnosed, the enzymes are included, as well as management of the diet. And the idea behind using diet and those enzymes are to manage symptoms, right? So that someone feels much better, much more comfortable, improves nutritional status. It'll improve energy levels. It'll enhance the body's ability to absorb nutrients and precious calories. And we have seen sometimes that the enzymes can help someone gain weight or regain their lost weight. I've included in your handout and on the slide too a link to this great educational resource about understanding nutrition and enzymes and how they can be very helpful. Okay, and last nutrition impact symptom I want to speak to is taste alterations. So I would advise these habits. I would suggest for anyone dealing with any type of taste change that they're really strict with their oral care. So there's mouth rinses that are over the counter, or you can make your own. I've included a recipe for you. And use this frequently. It's mild in the mouth, but it really helps to kind of clear the palate. And sometimes individuals I work with will time them, right? So they'll use that rinse before they know they're going to eat in about 15, 20 minutes. With most taste alterations all across the map, because that's what they are, right? An effective approach is to try cool or room temperature foods. I think it's because of the smell. So if something smells bad, or the opposite, something smells really good, but then it doesn't taste the way it smells, that can really throw someone off. So sometimes room temperature and cool foods help because there's no odor to them. It's surprising. I would encourage individuals to try foods that they never, ever liked before, because all of a sudden they may be appealing. So it requires a little bit of an open mind. And I find that breakfast foods are often preferred, even regardless of the type of taste change that someone's encountering. So we get creative. Again, we could have breakfast foods for dinner, right? And so it just is a little kind of thinking outside the box sometimes with taste changes. So here are the most common taste changes that I encounter when working with individuals: metallic, bad taste, no taste, and that meat tastes strange. So with metallic taste, we encouraged the use of plasticware or even baby-coated spoons to minimize those foods and beverages that were contained in a metal container at all. And now we have so many options to choose from at the grocery store. So it's nice to have that. The incorporation of lemon and lime, even just a little squirt of lemon or a little squirt of lime, is really combative for that metallic taste. And then it's interesting, berries and fresh fruit are often preferred. I find that individuals prefer them, right? And so what we do is we get really creative. So we'll put berries or some other fresh fruit inside their egg salad or inside their chicken salad that's cold, room temperature. And then what happens is that the berries or the fruit are like the vehicle that give them that pleasure, a good taste, but it rounds out, it carries the rest of the nutrition with it in that recipe. So for bad taste, we find usually tart flavors. So again, that lemon, lime, sometimes vinegar or pickled items. It may improve the taste of food. But I would say too, keep it bland and simple. I will never forget working with an individual who was a newlywed, and his wife wanted to make him a smoothie, and she threw everything but the kitchen sink into that smoothie. And he so eloquently stated to us in the room, he said, "I think I just want it simple." And so we streamlined that smoothie, and we only included about 3 ingredients. And for him, it put him in charge. And she was, as a caregiver, was able to help him. And it was like one of the best experiences of my life, that he advocated for himself. He found a way to help nourish his body. And it just required, that open-mindedness about trying something different. Now, sometimes individuals don't have a taste. They say, nothing's tasting right. It's just, there's nothing there. So we experiment a lot of times with different herbs and spices, or even more of them, and sour flavors, because they really perk up the mouth. And then sometimes, I mentioned this earlier, that meat can taste strange. So we might find ways to marinate the meat or dress the meat with a sweet and sour sauce or teriyaki, even citrus. That can kind of sweeten the meat, and that might be preferred. And then always, there are plant proteins that might not taste strange. So things like tempeh or tofu that provide bang for buck with protein, but might, again, be a little bit better tolerated. Okay, moving along. So next, let's look at some of the common nutrition questions that I get, as well as the questions that were submitted. Is it safe to eat dairy? Does animal meat increase the risk for metastatic spread? What are meal recommendations that are easy to digest? Other than Ensure, what can help prevent weight loss? More questions. Which foods will help maintain the right blood values to be able to receive treatment? What about nutrition? to address both pancreatic cancer and type 3C diabetes, and what nutrition advice should be provided following a Whipple procedure? Really great questions, right? Okay, so let's start first with that question: is it safe to eat dairy? In a word, it is. It is. So usually when individuals ask me questions, what I ask them to do is give me the source. Where did they come across this information, so that I can help them understand why that information was what it was. And is it false? Is it just misinformed? Is it not sharing the whole story about the concept? So that, I think, is very helpful, because we're bombarded with so much advice from so many places. And I always at the end want to point someone in the direction where they can confidently know they're receiving reliable information, but also too, to rely upon me as their trustworthy teammate. So it is safe to eat dairy. There are many nutritional benefits to both milk and yogurt, especially. They're kind of my favorites in the dairy family. They provide precious calories and protein for someone who might be at risk for malnutrition or losing weight. They provide precious vitamins and minerals. Remember, I talked about vitamin D and its role, but also calcium and vitamin B12, super important for our energy. So it also too is easy. I think it's an easy thing to manage. You know, if someone likes to drink a glass of milk, which every so often I encounter those individuals, that's a nourishing choice and it hydrates as well. Same goes for yogurt. You know, it's something very easy to pull out of the refrigerator and provides really a whopping dose of nutrients. Now, what about lactose intolerance? So this is very common. Some individuals have it regardless of being diagnosed or treated. So it might be a pre-existing condition, or the treatment may render them lactose intolerant. So what we advise then is to consider using lactase enzymes, a lactose-free product, which there are lots on the market, or a nutritionally equivalent alternative. I probably should have underlined and bolded that, nutritionally equivalent. So we don't want to just choose any alternative to dairy. We want one that's equivalent. Okay, and I'm going to demonstrate that point. So here are two nutrition facts panels for a dairy alternative that happens to be sweet, and another dairy alternative that happens to be high protein. So here's what I want to point out. This one on the left on the slide, it has 1 gram of protein per cup. Let's compare that to the label on the right. So the one on the right has 10 grams of protein per cup. So depending on the individual's goals or needs, we see there might be a clear winner here. What I also want to point out on the label on the left are the grams of added sugar. So this serving of 1 cup provides 13 grams of added sugars. If you remember, the goal for most females is 24 grams per day, and for most men, it's 36 grams per day. So this is a big chunk of change, in my opinion. Now, the product on the right, there's actually 0 grams of added sugar. So I think we found a winner. I don't know if you agree. But again, the best choice is determined on an individual basis. I would say for most individuals I work with, the product on the right is nutritionally superior to the product on the left. Next question, does animal meat increase the risk for metastatic spread? I'm going to answer this in a word again. The answer is no. So what the experts tell us is that meat is a valuable component as part of an overall healthy diet pattern. And that's because meat contains valuable nutrients that we're required for good health. Precious protein, iron, zinc, and also vitamin B12. Now, the experts think we should probably have a limit to how much we're having, and they suggest a maximum of 12 to 18 ounces of cooked red meat per week. And that's as part of a healthy diet. Now that's, in my opinion, that's a pretty liberal amount. That's a good amount of meat. So we don't have to worry about avoiding it. Okay, so it does not, there's no good evidence that suggests that eating meat will increase the risk for metastasis. Now, I would advise that individuals grill safely because it is the time of year when many of us are grilling. And I've included some tips in your handout about doing that. So when you place meat on a grill and char that meat, it can create carcinogens. So we want to minimize the creation of those carcinogens, and you can do that in significant amounts by following 3 of the tips that I included for you. Now, processed meat might be a different story. So processed meat, it ranks as being inferior, let's say, to red meat. There's really no redeeming qualities to it, except maybe it tastes good. So the experts advise that we limit processed meat if we can. So that includes deli meat, hot dogs, sausage, and bacon. If we eat it, there's no good evidence that it's going to increase the risk of metastatic spread. But the experts say, you know what? We don't really think it's nutritionally redeemable anyway. So let's just try to limit that as much as we can. They also, when they're grilled, will create some of those carcinogens as well. So here's some swaps or solutions for minimizing excess processed meat. If you enjoy breakfast meat like bacon or sausage, there's some alternatives on the market now, and I've included a recipe that I find delicious using tempeh. And it has a nice texture, a great way to substitute, a savory choice, but still also providing protein as well as a ton of other vitamins and minerals in that package. Now, deli meat, I think is a habit. So I think people just tend to do maybe like a sandwich for lunch, and it's just what they do. They don't really think about it. So I always work with individuals on this, and we just find some alternatives. You could easily make tuna fish, egg salad, chicken salad from leftover, and mashing it, maybe not with mayonnaise if they don't want it. Maybe they want to upgrade nutritionally with something that's equally high calorie like avocado, or something like hummus that might add really interesting flavor but different nutrients. And I have lots of recipes and lots of ideas for that. And then a hot dog, I think again, grilling season is upon us to take that as an opportunity to saturate the body with some vegetables, but not only vegetables, right? So it's quite all right to include small cuts of red meat or some fish or shrimp on that grill. Next, I wanted to share some meals that are easy to digest. This is also on that handout. So oats, I spoke to this earlier, they're high in soluble fiber, so they're very easy on the gut, and they slow the gut down, and they also bulk up a loose stool. So using that with milk if it's tolerated, or an acceptable alternative. And then even topping that with something like hemp seeds. I have hemp seeds here in the kitchen, and I can show them to you. They're really mild. They're not this tough seed, but they provide a whopping amount of protein. So it's a super simple application. Yogurt, even though it may contain lactose, is usually well tolerated for individuals that have an upset stomach, and it provides a good amount of protein. There are alternatives if necessary to consider. And I thought, why not turn that yogurt into a smoothie by including a gut-friendly fruit like papaya. So papaya has this natural enzyme called papain, and it also helps with digestion. Many individuals are concerned that they're not getting the nutrients and they're not getting vegetables into their diet when they have gastrointestinal upset. So a lot of times what we do is we just blend them. So we mechanically alter them so the digestion is done outside the body and it doesn't take its toll inside the body. So blending vegetables in a soup, my immersion blender is one of my favorite kitchen gadgets, or blending vegetables into a smoothie. Many individuals I work with do that as well. And then adding some leftover chicken, plain baked chicken, easy on the gut, into a wrap that's not necessarily very high in fiber. Scrambled eggs and toast with some applesauce, really gut-friendly meal right there. And then something like baked fish with asparagus tips. So the asparagus tips are another choice, high in soluble fiber. So we will often use them in some recipes for individuals that are dealing with a little bit of stomach upset. And then mashed sweet potatoes, again, taking that peel off because that's where some of the insoluble fiber is. That's a little tougher on the gut. Which foods will help maintain the right blood values to be able to receive treatment? What a great question this is. I answer this question, I would say, every week, at least once or twice a week. So I'm not sure what blood values this individual is referring to, but I'm gonna point out the ones that I get asked the most often about. The first is white blood cells. And unfortunately, I wish I could give you better news here. There are no known foods or nutrients that can increase white blood cell counts. And so if an individual is chronically low, we will talk about food safety actually in this circumstance and make sure that that person is following some guidelines so that they don't introduce any foodborne illness into their body. Unfortunately, we don't know of any foods that will raise white blood cells. As it relates to red blood cells, some patients will develop an anemia during their treatment or as a consequence of disease or surgery. Most often the anemia is related to that and not related to nutrition. So it's not for a lack of iron or one of the B vitamins like B12 or folate. It's not because of a lack of them. It's really due to the mechanism is faulty and not being able to use those nutrients that are already in the body. So saturating the body with more and more and more is not going to help. It actually may be detrimental in some instances. So what I would encourage you to do is discuss this with your medical team for all of these reasons, all of the counts. You know, why are they low? Can I do anything about that? Or what precautions should I take if I have low counts? Sometimes if the anemia is related to a nutritional deficiency, that can be evaluated. Okay, so iron, B12, or folate, that could be evaluated separately. And it should be before you decide to add more, whether through food or through supplementation, because again, more of those vitamins and minerals could be detrimental, and I don't want you to unnecessarily do that. Next, great question. What can help prevent weight loss besides drinking Ensure? So I would say review all the options that are out there. If it's because you don't like Ensure, there are so many products to consider, and that's where again an oncology dietitian can help. You can even make your own, and you can basically synthesize what's in a bottle with what you have at home, and maybe those ingredients are just that much better or taste that much better. Make each bite and each sip count. I call this bang for buck. So whatever you're putting into your body, make it count. And so actually a really good example is water. So while water is very hydrating, it doesn't give us nutrition. There's no calories, there's no protein there. So could you drink a shake or a smoothie, even a vegetable and fruit blend? There's a lot of different drinks on the market and ways to squeeze in a little bit more nutrition. If you're snacking on something like crackers, or if you're having some toast in the morning, could we just add more to it? Every single bite, could we add a little bit more, something like hummus or peanut butter, that mashed avocado, a drizzle of olive oil, like I mentioned. Each bite, each sip, make it count. Again, I call that bang for buck, but the food choices that have the most bang for calorie buck are those foods that contain fat. So we will really experiment and kind of taper or titrate up and down with the amount of fat that someone can tolerate to see how much we can squeeze in. It's really a bang for buck per serving. So examples of foods that are bang for buck are avocado, the oil, as I mentioned, nuts and seeds, and the butter versions of them. So as I mentioned earlier, liquid calories do not fill us up. So if you're losing weight, this is a great way to squeeze in more calories without feeling overfull. And so calorie-containing liquids sipped throughout the day are a great opportunity. And I just like to point this out. I think eat what you can when you can. You know, I think that as someone who's struggling with weight loss or maybe not eating enough, it can become a chore. You know, so I think do the best you can. You know, and look for those opportunities here and there. Give yourself some credit, self-compassion, and just do the best you can to squeeze those extras in. this question is one of my favorites. Okay, so what is the nutrition advice for pancreatic cancer and type 3C diabetes? So that type of diabetes is also referred to as pancreatogenic diabetes. And this is a specific condition when the pancreas is unable to produce enough insulin. It also may not be able to produce enough of those important digestive enzymes that I referred to earlier. And usually that condition is present in disease. So someone with cystic fibrosis might have type 3C diabetes. Someone with who had a pancreatic cancer surgery might develop type 3C diabetes. So usually that pancreas is just not able to do its job. And sometimes it's because of disease, sometimes it's because part of it or all of it was removed. So the goal here nutritionally is to aim for consistency. We see with type 3C diabetes that there can be really wide swings in both high and low blood sugar levels. So the remedy for that is to be consistent and to try to eat a pattern and similar portions at similar times during the day. So not skipping meals, not delaying meals, not having a big breakfast and then a small lunch. We want to be as consistent as possible. Because there is sometimes a tendency to go low blood sugar, we do incorporate some of those quality carbohydrates, including starchy ones, at meals, like potatoes, pasta, cereal, and bread. I mentioned this earlier, try not to skip meals, try to eat more small, frequent ones. It's so important to reiterate that, I think. And then to minimize high sugar foods and that high glycemic index food list that I provided earlier. That's going to spike blood sugar levels and really lacks the quality nutrients that your body deserves. So I would encourage you, here's what I think you should do if this is a concern of yours, discuss this with your medical team. You need to know, is there a specific carbohydrate controlled diet that is recommended for you? Do you need an evaluation of your ability to digest and absorb fat-soluble vitamins, and they include A, D, E, and K? Are they recommended for you because maybe you are potentially malabsorbing them? That needs to be evaluated first. I would also suggest an evaluation of bone health. And this is because individuals with type 3C diabetes often do develop some bone health concerns. And last but not least, work with a dietitian, right? And you could even look for one that is certified as a diabetes educator. So they exist. And this individual is experienced and trained to really best optimize that blood sugar control. Okay, and this is the last question. Fun. Okay, so what is the nutrition advice following a Whipple procedure? So the general guidelines in general are to eat small meals every few hours. So it all depends, right, on the timing of surgery and where that individual is at. So within the first month or two, that individual might be only having very small meals frequently during the day, and they may have to drink mostly liquids or soft foods as they recover. But with time, that affords the opportunity for more food to be included of different consistencies, more solid foods, right? And then also the portion size is expected to increase with time because the body is healing and recovering. We generally suggest individuals separate their liquids from their solids because individuals can only tolerate a small amount of food at a time, that we don't want to occupy that space with liquids. So we want to occupy that space with solid, nutritious foods and take those liquids in between meals. Generally speaking, we minimize fat, high fat foods, high sugar foods, and high fiber foods. And that's because there's just a difficult time to digest each of those. And also there may be problems with malabsorption for fat especially. So we look towards high protein and high calorie foods. I listed those earlier in the presentation. Individuals who had the Whipple, generally speaking, they probably need pancreatic enzymes. And so they should be included, the right dose, the right timing of them if they're prescribed. And working with a dietitian is always best because you can incorporate what foods specifically you like and what you can tolerate in order to make sure that the healing and the recovery from that surgery is maximized. And we know that nutrition has a role in that process. So here are some nourishing meals that we would suggest for someone who is recovering from their Whipple. Something like 2 scrambled eggs, half a cup of oatmeal, half a cup of unsweetened applesauce. Really good, right? And quality protein there. Low sugar, low fat nutrition shake. There's products on the market that we look at, or the individual can make their own smoothie. A cup of broth-based soup and maybe a half of a sandwich with low-fat cheese. A medium banana with low-fat yogurt, probably plain yogurt. 3 ounces of baked chicken, half a cup of mashed potatoes, half a cup of cooked carrots. So you see nice and soft and easy for the gut. And then something like a snack, a handful of crackers with some quality protein, right, in that peanut butter. So I wanted to include for you also some of my favorite resources. I mentioned earlier the World Cancer Research Fund and one of their institutes, the American Institute for Cancer Research. Tons of information there, from expert recommendations down to practical advice about recipes or meal planning, or dispelling myths that exist. So it's a great website for you to check out. I really enjoy PanCan, the Pancreatic Cancer Action Network. Lots of great content on their website, very helpful. I'm a member of the Oncology Nutrition Practice Group, and we have content on our website, including recipes and including answers to some great questions that get submitted. And then PanCan published a book called Cooking, Comfort, and Care, a cookbook that you can look for online. All of the recipes are located on their website. And then another one of my favorites is Cook for Your Life. She's a chef and she specializes in creating recipes that are appropriate for symptom management, especially. So if you need a bland diet, or if you need something that will address a taste change or diarrhea, she's got specific recipes to help with that. And I like that idea because sometimes as a caregiver, especially, it helps to have your loved one, the patient, look at the recipes so that the patient has autonomy to decide, which is really empowering. But something may strike that individual about that recipe. So to kind of like do it in a way that's really pleasant and positive, I think is a great idea in order to help our loved ones eat better. And I just want to summarize that nutrition is critical for every stage of the cancer journey. Nutrition counseling from an expert can improve outcomes. Personalized nutrition is best. I couldn't say that enough. I think that's probably the most important point today. And use this information to be your own best advocate or your loved one's advocate. This is my business card, so my contact information is here as well.
I think Susan's first question about vitamin B and vitamin D has been answered since she typed that in. She also asked, though, when you have chemo, your mouth goes really dry. Is there anything that you would recommend, Lori, to help combat that?
What a great question. So what do we do for dry mouth? As long as there's no mouth sores, we suggest lemon, that perks up the mouth, and actually chewing. So what happens is when we chew, it stimulates our salivary glands to produce saliva. So we sometimes will look at sugar-free products like gums and candy, because if they're going to be in the mouth all the time, we don't want all that extra sugar maybe. Or it's very interesting. I find some individuals, as long as they're tolerating it, they like cucumber slices or an apple, because that moisture, most of our fruit and vegetables are high in water content. So it's very refreshing. But then again, they're chewing. So it helps to create saliva. Carrying water around all the time. Like I just discovered this water bottle that I love. It's a shaker. And it has these compartments where I could put a protein, or I can shake in a little extra hydration into this, and I carry it with me everywhere. That's important for dry mouth, of course. And then 2, frozen grapes. I find I work with head and neck cancer patients, and they like frozen grapes or frozen melon balls, and they just sit it in their mouth. It's great.
Awesome, thank you.
ideas.
And then a question from Janice. How do you feel about meat substitutes such as Impossible burgers or sugar substitutes like Swerve or Stevia?
Great questions. I love this. Okay, so some of the new products on the market, like Impossible Burger, and I hate to name names, but I'm going to do it. They are manufactured with some synthetic ingredients that we don't really know enough about. So, but there's also other meat alternatives that don't have those synthetic ingredients. Okay, so it's really all about, again, choices and decisions. So if you are someone who is just looking to, this again is where knowing the individual helps, because if you're someone who is eating a lot of meat, and not eating a very healthy diet, but is looking to use meat alternatives, that may actually be a step in the right direction, right? But if you're someone who is eating really pretty well and looking to incorporate plant proteins, we might explore some ways to do that in the kitchen, by using beans or lentils and making your own burger that way. That's going to be nutritionally superior to some of the products on the market, because you're going to get more cancer protective compounds and you're still going to get the protein that you might need. With regard to Swerve and Stevia, the experts say that with all artificial sweeteners, that they are the amounts that we consume are not cause for alarm for cancer. I do think that, it depends on the individual. If we can minimize the consumption of them, I prefer that. But again, it matters what that individual's diet looks like in the first place. So if they're drinking, liters of soda, switching to diet soda or diet products might make more sense. It might. But then eventually the ultimate goal might be to substitute in with more nourishing choices that are going to support someone's well-being in their entirety.
Okay, that sounds great. Another one was, what foods would you recommend to mitigate or minimize chemo side effects?
Yeah, side effects from treatment, from all forms of treatment, that they can be significant. And so where I am in clinic, I'm a member of the team, the interdisciplinary team, to make sure that we are maximizing every possible intervention we can. So it includes sometimes prescriptions, sometimes adjustment of them, or changing the dose. It requires a look at over-the-counter products to manage symptoms. And then the diet is adjusted in order to complement that and to make sure that the person I'm working with is staying as nourished as possible. And so that's different things for different side effects. And that's where working with the dietitian is very helpful, because I find everyone is different. Even two people with the same side effect, like nausea, they require two different approaches. And I think that that's why I do what I do. Every single person deserves to know what that approach should be.
Great, thank you. And I think the last one that I have is, what would you recommend for someone taking Creon and looking to eat low to no fat?
Great question. Okay, so if the Creon is doing its job, we can go low fat, because low fat is advised in general for a healthy diet. And we want good fat, because we're finding that good fat matters for improving overall health. So we don't need to fear fat. And if we're not absorbing it or digesting it the right way, it may require appropriate review of the Creon or the pancreatic enzymes, in that they're doing their job. Sometimes I find in my own professional experience that they're underdosed and that they need just a little bit more of those enzymes, or they need to troubleshoot how they're taking them. And that affords individuals to enjoy a little bit more of those healthy fats, right? Like avocado and nut butters or the whole egg, because they are valuable in terms of adding nutrients to the diet. I hope I answered that.
Awesome. Thank you. And then I guess, sorry, I missed one in the chat from Teresa. I think she's referring to the dry mouth conversation we were having. She was saying that her husband doesn't have a lot of teeth, so like chewing things is difficult. But could you tell us maybe what you were referring to, the hydration pack that you were adding to your water?
Oh yeah. So I'm not endorsing any products. I'm not allowed to do that. But this is something called H2ORS, and they have a berry flavor and a lemon flavor. And I included some recipes for hydrating fluids on your handout, or in your handout, I should say, because even something like, I'm going to name names again, something like Gatorade or G2, a lot of individuals I work with drink them. We actually recommend adding some salt to that, because that's the appropriate distribution of the electrolytes that will be hydrating. But they also are sugary. So sometimes it's an individual is losing fluids because they have diarrhea. That excess sugar might exacerbate diarrhea. And I also, with individuals I work with, some have an aversion to sweet, like it's too syrupy sweet after a time, and they get kind of fatigued from that sweetness. So we'll create lots of different, even using broth, lots of different ways to hydrate in ways that will be best tolerated in the gut, So, but this I just love. So I carry this around with me because there's a shaker. So if you have a protein, if you're using a protein, like there's powdered proteins, you can carry it with you. Like you don't have to make it in the morning and then maybe you're not ready to drink it until the end of the day. So it comes with these little compartments. So if you have some Creon, you could put the Creon in here, or if you have something over the counter, you're taking maybe ammonium or something else you need, like an antacid, you could store it in here. And then this compartment too for the protein. And so I just keep it in there, and then when I'm ready, I'll just add it, give it a shake, and I'm good to go. So it's great for helping me meet my hydration goals, but also too, like it could suit anyone that needs more protein or more electrolytes. Great product. I love it. And what I'm going to do very quickly, there's actually a nut butter. I'm a fan of Trader Joe's. So this comes from Trader Joe's, and it's a crunchy salted peanut butter. And there also are flax and chia seeds in here. If you have digestive upset, please don't use this product, okay? Because flax and chia seeds are going to be very upsetting to a digestive tract. So you might just want to use smooth peanut butter. And I scoop this out, but it's not very runny. So I'm just going to heat it up very quickly on the stove or in the microwave. And then, so to this bowl, I'm going to make sure you can see, one of my pantry staples, oats. So I have this is a huge container, and I keep it at my own house, but also to a Cancer Wellness Center. This is old-fashioned rolled oats. I like to get old-fashioned rolled oats because they're more versatile. So you could use them as is. Like I love this as breakfast. Like I'm good with this, right? But you could grind these either with a processor or a blender or your spice grinder, and that's going to be easier to digest as well. Or you can use it like as a breading. Like if you're making chicken or fish and you want to substitute these for breadcrumbs, it's such a versatile ingredient. Okay, so to my bowl, I'm going to add my oats, and then I'm going to add cinnamon. You can add ginger, you can add nutmeg, you could add, I wonder what else, pumpkin pie spice, that might be good in here. So a little bit of that in there, and you have the recipe again, okay? And then to this, I mashed 2 bananas, good for the gut, so we're going to add that in. So simple. So simple. I forgot to stir these together, but that's all right. And then we're going to add the peanut butter. If you wanted to sweeten these even further, you could add a little bit of honey or maple syrup to this mix. If you have an allergy to peanuts and you want to use sunflower seed butter, that's certainly an option too. So again, you see, you can kind of play with the ingredients based on what you need. Now, I like to get my hands dirty, and I'm going to be the one eating these. So I just like to mix with my hands. So we're just going to combine. That's it.
So Susan is saying, if someone has a stent and can't have fiber, is it okay to blend those? And can we then do fibrous things?
Yeah, what a really good question. That definitely requires, with a stent, you need to talk to whoever put the stent in, or who is your, trusted, regularly consistent healthcare provider about any fiber restrictions, because you don't want to block that stent with fiber. And it comes down to how much. So that's, again, where a dietitian can help in meal planning based on your prescribed amount of fiber. So something low in now I got to say too, most of us don't eat enough fiber. So just keep that in mind. But something low in fiber has less than 3 grams of fiber per serving. So it's all about not taking in excessive amounts of fiber or manipulating the food to make sure it's more easily digested. Okay.
That's what I was asking, was like, if it's masticated like in a Vitamix, is it like, so I was thinking like cherry season, could we put it and like mush it?
Yeah, I would probably cook it down first a little bit to help break up some of those fibers, and it's about how much. I wouldn't add too much of those cherries. Or you could get, like, a great alternative would be tart cherry juice. If you're looking to still, I know cherries are delicious, right? I actually work with individuals who will chew food and spit it out if they have swallowing problems, because then they can still taste the food. But if you're looking to deliver those nutrients, I would say tart cherry juice. Like, that's a nice concentrated source if you wanted to try. Now, hopefully you can see I'm rolling these into nice little balls, and you can enjoy them as is, or you can put them in the freezer. They're going to stay in the fridge for a week. You could put them in the freezer for months. So they're great for meal prep. Now, you could also add like vanilla extract to this. I put hemp seeds out because I could roll these in hemp seeds for like a little coating on top. You could add shredded coconut, unsweetened coconut. You could put some chocolate chips in here. You could drizzle some chocolate on top. And you can form the balls to whatever size you want. Again, if you're looking to really maximize intake and get more calories into somebody, you might even want to make these smaller, because then visually they don't look so overwhelming. You know what I mean? So sometimes that's how we manipulate with portion size and like play obstacle illusion. But these are great for on the go.
There's a lot of psychology in nutrition.
There sort of is. But it's a really important point to make, because we interact with food. We have a relationship with food, and knowing what someone's motivation is, like Janice shared, she was a foodie, or still is a foodie, thank goodness. And we want to preserve that.
Well, because I think sometimes as the caregiver, we have a goal in mind, this many calories, this much fat, this much weight gain, but for the patient, there is still, but like that energy ball looks too big and now I'm overwhelmed and life is already overwhelming. So taking it back a notch and saying, okay, like you said, look at this recipe book. Is there anything that does get your attention? Engaging them, making it smaller, getting rid of the smells, anything that brings back that enjoyment. I mean, the beginning of your presentation, where quality of life, and we have such a connection with food, whether it's your grandma's kitchen or the Christmas smells. Yeah. You don't want to take that all away and just make it you have to eat this because it sustains you. It's like, no, how can we make this enjoyable? So that was huge.
Really just yummy. I think like great combination of flavors. Again, you could add the spice or flavor that you prefer. Great to make ahead of time and batch cook and then travel. They're on the go snacking, and they're superb.
Well, and a lot of patients and caregivers are traveling, during those treatment days and whatnot. So that's a great.
Yeah, or sitting in the chemo chair for hours.
Oh, also that.